All right, you're all welcome back to the OET mock review. Now we'll be reviewing nurses writing task. The task I gave the nurses, that was on Sunday, isn't it? Yes, 3 days ago. So let's look at that task together and see how, because I think it was only Clement Precious that crossed 350 for nurses. Although everybody that wrote that writing actually passed, because for the nurses, your pass mark is 300. Yeah. But I think Clement Precious scored 360 in that writing. So let me project the writing again. You can actually go to the Telegram group, yeah, and if you cannot see it clearly on the screen here. So for the nurses, the writing task actually says, using the information in the case note, write a letter to Miss Samantha Bruin, senior nurse at Grey Walls Nursing Home, 26 Station Road, Grey Walls, who will be responsible for Mr. Baker's continued care at the nursing home. Now, for the nurses, they clearly stated the purpose of the letter in your writing task. Here, they said, who will be responsible for Mr. Baker's continued care. So the purpose of this letter is for continued care. Now, whenever you hear continued care, it's most likely might be suggesting to you, maybe they've been taking care of these patients before. Now, to confirm if this patient has been in this nursing home before, let's go to the patient's address to see. If you go to the patient's, okay, they didn't state, they didn't state the patient's address. Yeah, they did in the social history. They say lives at Grey Walls Nursing Home. They have been there for 4 years. And the person we are writing now is also in the Grey Wall Nursing Home. Yeah, at Grey Wall Nursing Home. So this patient has actually been there. So perhaps it was from the nursing home this patient was brought to your hospital to have this surgery done. The patient had surgery done. And what was the surgery that was done for this patient? This patient had a left total hip replacement done. Because of worsening osteoarthritis, he has been having difficulty mobilizing. So this was the problem. He has been having difficulty mobilizing, and this surgery was performed, and the patient is getting better now. Now the patient has to go back home to nursing home where he used to be. Now, for this type of patient now, will there be any need telling the reader that this patient's hobbies, the patient like playing chess, ham radio operator, and the patient has sister is done medicine, visits regularly and very supportive. And then this medical background, yeah, that is hypertension and all that. Do you think it will be relevant in this letter writing? I'm asking the nurses, because some of you added all those things in their writing.
No, it's not relevant.
It will not be relevant. These patients have been in this nursing home. Definitely, they have the patient records. They have the social history about this patient, even this medical history. All the patients, definitely they've been given a nursing home. They will be giving this patient antihypertensive every morning to take. Yeah, maybe they've recorded it. Maybe there might be some incision in the hand, and they would have asked what happened to the hand. They would tell them it has to go. So this would have been in the patient's records. So I really don't see any need why some of you now have to bring this again to be telling them in the nursing home what happened. So what you're supposed to do in this case, the background is off. So in your letter, remember I say it has 5 parts, but in this case, your own will be having 4 parts because the background here is not relevant, isn't it? So the 4 parts it will now be having will now be the introduction, the treatment so far, what have you done for this patient so far, the current situation, this patient, how the patient is doing, because the reader have to know. You are sending the patient back for continued care. Is this patient better now or worse off? So you have to discuss the current situation. After the current situation, you make your recommendation, things you want the reader to do for the patient. Okay, so that's how this letter would look like. So let's see the way I wrote this letter. So let me zoom it again because for clarity's sake. All right, so this is the address. This is the date. Remember, in the address, after writing the name again, you write the person's designation, then before you now write the address. Then this is the date, the greeting, the real line or the heading. Now, in my introduction, I'm writing to inform you about Mr. Gerard Baker. If I don't want to use inform for the nurses, what other word do you think I can write? Because these people already know these patients. What other vocabulary can I use there?
Update.
Very good. That's another nice one to use. I can say, I'm writing to update you. Do you understand? Or I can say, I'm writing to bring you to speed about Mr. Gerard Baker, yeah, who is recovering from left total shoulder replacement done due to worsening osteoarthritis, limiting his mobility. Now, I've described the problem. Whenever you are writing like a discharge letter, it's always good to bring in, not just only describing the problem, still let the reader know how the problem is now. That's why I say who is recovering from left. So the reader already know from the introduction that this patient is already getting better. Following his discharge today back to the nursing home, he will be requiring your continued care. So I've stated the purpose of the letter here now, so that the patient will be requiring continued care. So I'm done with the introduction. The next thing to do now is to discuss the treatment so far. What have I done for the patient so far? It's just for me to summarize it. The surgery was conducted on this date. It's very important to state, because after some days or weeks, you might start telling them, remove the staple, remove this. So you state the date. The surgery was done on this date, and the session site has been on daily dressing. He has also been engaging in stretching and strengthening exercises with the involvement of an occupational therapist. So this is the summary of what we've done for this patient. Is the treatment so far, yeah? After the treatment so far, the next thing is to go to the current situation. How is my patient doing now? I have to let the reader know. Mr. Baker has made tremendous improvements as he can bear weight, and we can bear weight with the use of a wheelie walker and able to walk appreciable distances with less difficulty. However, he had post-operative disorientation during recovery, probably precipitated by anesthesia. His hemoglobin level was optimized to 112 per DL with 3 pints of Paxil, following a fall at 72 grams per DL after the surgery. Now, the way I wrote this thing now, I made it to be the current, how the patient is now. I have to let the reader know that the hemoglobin now is 100 compared to 72 that it was immediately after the surgery. Another person writing this might decide to make this to also be the treatment so far. Do you get? And say that maybe after, with the involvement of the occupational therapist, you can now bring in here and say that following the surgery that he had, after the surgery he was conducted on this and his son had been on daily dressing, I can put it as second sentence here, that following the surgery, his blood level fell to 72 grams per DL and he was anemic. Now, I can also say that he also has post-operative disorientation during the distance. Then coming to my current situation, I will now let the reader know. Due to the anemia, I'll refer back to it. I won't repeat what I've said before. Due to the anemia, I can say like this, that his hemoglobin level has optimized now, has been optimized to 112 following the anemia he had. Or I can even remove that following the anemia he had. I can just say that it has been optimized. Do you understand? So we can always, your sentences will not be exactly like mine. Do you get? But the flow of thoughts, the organization should flow in a way that it will be reasonable. Then after the current situation, I've told this reader how this patient is now. I would appreciate, you can see these two letters that I reviewed today, there is no place I say in view of the above, that most of you will always use. Just try to avoid it. In your recommendation, start it by personalizing it. And if you can see here, I used 2 paragraphs for my recommendation because I had a lot of things to write. So I would appreciate if Mr. Baker is continuously observed for anemia and mental alertness. Please chase his full blood count and UEC test at City Hospital, and his staples should be removed on these dates. Yeah. Mr. Baker will need some equipment such as a wheelie walker and a wedge pillow, which will be provided by the hospital, and a toilet racer to be hired for 2 weeks. This will be arranged by the social worker. Now, some of you that wrote this thing, this recommendation justice was not done to it at all. When you are making your recommendation, try to bring in everything from now on that this patient will need to be done. Try to bring them in and explain them, because that's why you are writing that letter in the first place. You don't just say and say, in view of the above, your ongoing care will be appreciated. You run away. Do you understand? Everything that they want for this reader to be done for this patient, you just ignore them. That doesn't make any sense. Okay, so for the nurses, do you have any question? Any question? Hello? Hello?
We can hear you.
I was now wondering what's going on. So I hope you guys heard me to the last part of the letter, isn't it?
Yes.
Okay, that's fine. So I'm now referring to the nurses now. Do you have any question regarding this letter writing? Because some of you, it was very difficult for you, and some that added the background, they started telling us what they did for the patient, and then brought the background in between, and then came back to now start telling us how the patient is doing now. Even if you are to bring the background in this letter writing, I think the background should come after you've described all this stuff. Yeah, after all these ones, you now bring the background here before you start your recommendation. For this letter now, if we are to add the background, let's say we are writing to somebody that don't know this patient before, the background will not come up because the background is not directly the cause of this patient. The hypertension and all those things that the patient will have is not directly linking to why this patient was admitted. All right, any question, please? Okay, so we call it a night. Okay, Precious, you want to say something?
I said the corrections are well understood, sir.
Okay, that's fine. All right, I'm going to still upload this one too on my YouTube channel. If you need it, you go there and watch it. The whole thing is already recorded. Do have a great night, guys. Bye. I wish you guys the best writing this Saturday. Bye-bye.
Thank you.
Yeah.
Bye.